Hello, everyone. This presentation is about the key elements of interprofessional education for pre-licensure students. The presentation is for the course Interdisciplinary Collaboration at the University of Ontario Institute of Technology. This topic will be covered by Charlene Huzenga, Sarah Stone, Stephanie Crouch, Zoe McIntyre, Chris Simcock, and Kelly Doyen. The pre-licensure stage of a healthcare professional's education is the best time to introduce interprofessional education. In order for the student to gain meaningful knowledge that will be utilized in their professional career, the interprofessional education program requires several elements: dedicated faculty from different programs with experience in IPE, a common curriculum delivered to a variety of healthcare students, a common goal to increase patient care and collaboration, and a well-developed culture of valuing shared learning.
The accreditation process in Canada for pre-licensure health professional education promotes the improvement of curricula and programs and is a driving force for change. This process includes the establishment of standards and criteria, site visits to educational institution or programs, and periodic reviews to ensure this criteria are being met. The Accreditation of Interprofessional Health Education project is founded by Health Canada and was created to accredit pre-licensure education for physiotherapy, medicine, nursing, social work, pharmacy, and occupational therapy. There is a need for accreditation of IPE in these six health professions. However, only pharmacy programs have specifically addressed IPE so far. Accreditation bodies are now being urged to include standards for interprofessional practice as a requirement for program approval. There are many IPE essentials to take in consideration when developing a program. IPE requires appropriate faculty development, collaboration with other healthcare disciplines, common goals, effective communication, resolution of timing and schedule problems, and commitment of resources. It is important to have more than one faculty involved since some problems may come up that would be in someone else's area of expertise. This knowledge gap could hinder patient care and does not provide the best IPE learning experience. Not only should faculty from a variety of programs must be represented, but they should be dedicated and willing to fully commit to the learning experience for students. The teachers must have skills and desire to teach, model, and mentor interprofessional care. When in clinical setting, it is important to allow student feedback on how to improve IPE. For instance, some students feel as though they can't approach other healthcare professionals as they are always so busy with patients and other work. Similarly, the healthcare professionals would run out of time and have to leave the meeting early. In order for these to be an effective interprofessional collaboration, each party member must be able to put aside time to discuss the issues and share their thoughts. Normally, healthcare professionals are very isolated and don't communicate with other professions. Ultimately, they have limited knowledge of other healthcare professionals in the team. They don't understand their expertise, responsibilities, skills, and values. Healthcare professionals are expected to work collaboratively to ensure the best patient care. Therefore, they should engage in these activities throughout their education, clinical training, and professional development. Students have traditionally experienced limited contact with other healthcare students in different programs, so they learn very little about collaboration. Some barriers to IPE include lack of administrative support, lack of rewards or incentives, overcrowded curricula, and scheduling conflicts. One of the most important barriers to overcome when it comes to IPE is called attitudinal barriers. Many healthcare professionals feel as though IPE is insignificant and not worth precious resources. As they work in relative isolation from other healthcare professionals, as they are in different departments or areas, and may exhibit professional arrogance. Because of this isolation, many people don't understand the roles and relationship of the other healthcare professionals in their team. They may look down on other professionals and think that they are more superior to others. Studies show that IPE in pre-licensure students prevents formation of these negative interprofessional attitudes.
Common curriculum competencies describes one role and responsibilities clearly to other professions. It recognizes and observes the constraints of one's role, responsibilities, and competence, yet perceives needs in a wider framework. It recognizes and respects the roles, responsibilities, and competence of other professions in relation to one's own. It works with other professions to effect change and resolve conflict in the provision of care and treatment. Works with others to assess, plan, provide, and review care for individual patients. Tolerate differences, misunderstandings, and shortcomings in other professions, and facilitate interprofessional case conferences, team meetings, etc. Enter into interdependent relations with other professions. In order to accommodate these competencies, healthcare professionals should reposition interprofessional education in the mainstream of contemporary professional education. Interprofessional education is not typically a part of the main curriculum for many professions. If students are subjected to learning new aspects early in the program, students are more likely to have a positive impact for interprofessional collaboration. Obstacles to developing a common curriculum. The healthcare system is constantly put under stress as government funding is reduced, lack of faculty support, and time constraints. In order to teach professionals about the other duties, time must be put aside and designated for education. There are issues with how the lessons are taught. Commonly, interprofessional education is taught in a lecture hall and does not involve much direct contact and collaboration of different professions. This is an ineffective form of teaching and must be remodeled to simulate real-world situations. However, there are other factors that make a common curriculum difficult. Hospitals tend to have patients from a specific heritage or culture, and their customs must be respected. Also, there is a lack of involvement from multiple communities outside of the hospital, such as researchers and other facilities.
To resolve these obstacles, new approaches must be considered. This includes job shadowing and pairing teachers and learners, also known as double booking. However, if done in the hospital alongside working professionals, the time issue can be resolved as patient care is still carried out and the professionals still learn from one another. Therefore, providing a common curriculum will not only increase understanding of other professions, but reduce time, stereotypes, and provide improved patient care. In a study, a student commented on their experiences of collaborative case studies. She found there was a much greater appreciation for other professions as members had to work together to solve a case study of a patient. Also, the members of the group had to research one singular profession, which was radiologist. This allowed for both the positive and negative viewpoints to be expressed by the other group members. This helped to break down barriers of stereotypes and enlighten other professions of additional duties they can provide. To correct this problem of cultural heritage, educators must communicate with local researchers to understand how best practices in interprofessional education can be applied to their local context and develop curricula based on existing resources and local needs. This will lead to an interprofessional education framework that is specific to the local region and takes into account culture, geography, history, challenges, and engage numerous community layers such as health workers, researchers, and facilities. Teams need to have a common goal. Without a goal, the team falls apart. Discussions need to occur on why the team exists. All team members need to have commitment, and all actions that are initiated by the team need to express the common goal. If teams are struggling with the actions they are putting forth, they must always prioritize by turning to the common goal. To increase the patient's care, a common goal needs to be put in place. This common goal should push communication, coordination, protocols, procedures, and collaboration to the forefront of all staff's concentration. The main goal in any institution should be the health, well-being, and healing of all its patients. To obtain this goal, it should support all professionals working inside it by developing their interprofessional education. Interprofessional education, when used properly, ought to promote accountability and collaborative care. In order to understand collaboration, we must understand the difference between team, teamwork, and collaboration. Key Strategies in Healthcare Renewal defines them this way. A team is a collection of individuals who are interdependent in their tasks, who share responsibility for outcomes, who see themselves and who are seen by others as an intact social entity embedded in one or more larger social systems, and who manage their relationships across organizational borders. Teamwork is when two or more professionals provide care for patients interdependently of each other. Collaboration is the relationships and interactions that occur between coworkers. Teamwork is only one form of collaboration. In plain words, teamwork is when teams work as one unit, and collaboration is the enhancement of this teamwork by including professionals from other areas of healthcare. Improved collaboration among healthcare professionals as a key strategy in healthcare renewal. When all disciplines understand each other's jobs and responsibilities, it is easier for accountability to take place. The level of collaboration required by healthcare providers increases as the interdependency rises. Some operations, such as bone marrow transplants, requires doctors, nurses, and the lab personnel to be present. These three groups need to work together in order to accomplish this process in a timely and efficient manner. When everyone knows who has to do what, the results can come together faster for the good of the patient. Nobody likes feeling like their job is unimportant or underappreciated. When students are educated on the jobs of all medical personnel, they go into the workforce with a greater appreciation for what everyone does and how everything works together. Everyone is working towards the same goal. The health of the patient is primary, so things run smoother if we work together, do our own job, and do not interfere when others try to do their part.
Although many students learn the value of interprofessional collaboration in a classroom setting, it is only when out in the workplace the reality of the barriers between each profession becomes evident, as well as their impact on the healthcare system. It is the misunderstanding and lack of education that can lead to poor work habits which diminish the quality of the patient's care. Not knowing the different professional practices and treating other professions as inferior demonstrates inadequate teamwork and leadership skills. In order to eliminate these barriers, one must foster a care that values shared learning and that diminishes stereotypes and poor attitudes while promoting collaboration within the healthcare environment. There can be certain beliefs among professionals and the work they are responsible for is more important than the work of others. While having pride for one's own profession is natural and encouraged, developing a superior attitude can constrain lines of communication not only between peers but also amongst those in the healthcare team. It can lead to misconceptions about the attitudes and responsibilities of other professionals and lead to what some may consider a hostile work environment. Furthermore, not knowing the specifics about the roles of other professions performs narrows one's knowledge when discussing a diagnosis of care plan of an individual. Ignorance of the situation in its entirety may lead to uncomfortable encounters and repetitive explanations on the part of those whom have been consistently overlooked. Studies have shown that the lack of understanding of other professions leads to a hazy awareness of the working relationships. In many cases, professions overlap, and it is essential to know the strengths and weaknesses in each discipline so one may be handed out accordingly to ensure the best patient care possible. One of the leading barriers in today's society for healthcare teams is organization. Above all, role ascentation and times are crucial for organization in healthcare settings as they affect patient turnaround times. When a team is unorganized, they may be under the illusion that they are being productive, when in fact the bulk of the work has either been forgotten or has not been completed to a satisfactory degree. This severely limits efficiency in the workplace. especially in a healthcare system, as tasks must be completed in a certain order for the process to run smoothly. For example, a doctor must educate a patient on blood donation, and a nurse must collect a signature indicating the acceptance of the donor blood before the lab technologist can issue units. If any person in the group is unorganized, the treatment cannot progress on schedule. Even small courtesies such as punctuality can affect overall outcome of the healthcare team, as repeated infractions can set the mood for the meeting and impact productivity. Another barrier to interprofessional collaboration is financial. Having the funding to organize collaborative professional education is not factored into the annual budget planning, making it difficult to integrate programs into the work setting. These sort of events often require actual physical gatherings and often during work hours. Not only do institutions lose the presence of their professionals for several hours, they must also pay them for their time management. To do this on a large scale might seem impractical to most workplaces, as they are paying personnel while not receiving any assistance with might be a large workload. Overcoming these attitudes or planning a budget for interprofessional collaboration is another aspect to overcome when attempting to provide optimal patient care. When discussing professional education, it is the involvement of multiple professions learning together on an interactive basis as is the key element of interdisciplinary collaboration. Studies have shown that collaborating with other peers within your workplace increases positivity and overall patient satisfaction, as well as decreasing the rate of clinical errors. Though it may not seem difficult to overcome the barriers previously stated, it cannot be achieved on an individual basis, but only as a team. A system of shared values must be implemented in order to overcome any potential barriers so the team can perform in an efficient manner to ensure best possible healthcare is administered to the patient. Having a neutral work environment to meet with other team members is important to ensure that one profession does not overshadow the other. This can help prevent the different professions from isolating themselves and developing their own system independent of each other. Implementing a leader within the team is crucial, since it provides an administrative support system that enables others to follow an organizational routine that implements order. Furthermore, early education may help prevent misunderstandings between group members and the roles they may provide. It may douse feelings of superiority that can sometimes develop when part of a group is completely unseen. Shared credit between each group member is vital to ensuring a positive environment that helps boost team spirit and overall morale. The earlier that one starts with their interprofessional education, the earlier they will not only benefit themselves and their team, but to those in need of health care. By having an earlier understanding of key concepts which make up interdisciplinary collaboration, they can prevent negative attitudes which can hamper future performances. Having an open mind towards others will lead to a more efficient team, one that stresses the importance of interprofessional collaboration in patient care.
Interprofessional collaboration education is essential to be introduced at the pre-licensure stage of a healthcare professional's educational path. The tools that are necessary to be able to contribute to a professional healthcare team should have a sound foundation by the time healthcare professionals enter the workforce. Emphasis on collaboration, team building, and dedicated staff members with different backgrounds who share a common goal will help to develop a culture of valued learning.
Thank you for listening to our presentation.